Welcome, everybody. This is Corridor Conversations. Typically the fourth Saturday of the month, but we're the fifth this month because of Memorial Day. Most of you look like you're regulars, so welcome back. But Carter Conversations was started actually around the time of COVID, and we've been doing this ever since with monthly sessions of variety of topics, focusing basically on the Route 1 corridor, people in our neighborhood, our neighborhoods, and it's really been quite interesting. We are sponsored by Hyattsville Aging in Place, College Park Neighbors Helping Neighbors, and Explorations on Aging, University Park Helping Hands, and recently Mount Rainier Gateway. I'm going to get the name wrong, Carter, but they're
Gateway Aging Together.
Gateway Aging Together. So the idea is to provide information and allow for these back conversations and things, primarily for seniors, but we welcome anybody. It's usually topic dependent, obviously, and so in general, we will excuse me, I will introduce our speaker, and then we will have, I can't remember what you said, Jenna, but I think unless you all have a burning question, let her go through the slides. And if you put your question in the chat, Carter and I will keep an eye on that and bring your question forth. Obviously, it's something you don't understand that she just said. You can put your message in the chat or use the raise hand thing on your screen. Today, I'm really excited for this conversation. We're going to talk about Longevity Ready Maryland. And just to give you a little background, it was 2026, just this past, the Maryland General Assembly, excuse me, passed landmark legislation that will change the way the state of Maryland looks at aging and addresses aging. The way the state approaches it, one of the main things they wanted to do when Carmen Rojas took over as the Secretary of Aging was to break down the silos, as she called them. So they were trying to work out ways where various government agencies, the right hand does know what the left hand is doing and that sort of thing. As I understand it, and Jenna will go into this in more detail, there are four main goals. One is to build a longevity ecosystem. Two is to promote economic opportunity. Three, prepare residents to afford longevity, exclamation point, exclamation point. And then to have optimize health, wellness, and mobility. So we are so lucky today to have the Assistant Secretary of Aging for the state, Jennifer Crawley. Jennifer actually grew up in College Park and is a graduate both at the bachelor's and the master's level from our wonderful university. Jenna has over 25 years of experience in local government and the private healthcare industry, including program administration, populations, health, patient advocacy. And prior to joining the Department of Aging, she served as the area agency director on aging for Howard County. And was there responsible. She oversaw programs and services for older adults, caregivers, amen to that, Jenna, because they're frequently ignored, and people living with disabilities. And before that, she worked with Medicaid and worked through in the District of Columbia Department of Healthcare Finance, and was the chief social worker for a home-based primary care. So she's very well qualified, as you can see, and we are delighted to welcome our neighbor, Jennifer Crawley.
Well, thank you, Marianne. That was a wonderful introduction. And I'm just delighted to be here with all of you. And As Marianne said, I am a bit of a hometown girl. I grew up in College Park on Wake Forest Drive, in the house where my dad grew up and where my parents, both of whom are in their early 80s, still reside. So, and I am a proud product of Prince George's County Public Schools, went to University Park Elementary, Hyattsville Middle, and Northwestern, where I graduated. And I really believe that my growing up in Prince George's County helped to shape who I am and really put me on this trajectory of going into social work and really believing in the power of community. So I'm thrilled to be here. I see some familiar faces, some familiar names. And so thank you so much for having me. So I'm going to do my presentation a little bit differently than I usually do. And that is I'm going to start with the local piece before, okay, but let me see how I actually, oh, there we go. The local piece before I kind of get into more of our state level work. So first of all, I just want to say May is Older Marylanders Month. So this is very apropos for us to be connecting today. Governor Westmore declared May, or proclaimed May, I should say, as Older Marylanders Month, really recognizing the value, the contributions, and the meaning of our older adult community across the state. So thank you. I just wanted to share that. I also am just thrilled to be here talking to so many villages. And let me say, I did not realize how many villages are actually in Prince George's County until Marianne and Carter and I were talking on Thursday. And so we really believe that the village movement and model is the key to building community, decreasing social isolation, and also really creating a way for all of us to age in community and to thrive in community. So we actually have intentionally and strategically been promoting the village model. And as of right now, there are about 47 villages across the state. And like you said today, more are coming on board every day. We actually have a program manager, Chelsea Wheeler, who is focused on supportive communities and what investments we can be making to really drive more villages and figure out how we can support you all best. So one of those ways that we're doing that is through our Aging in Place grant. I believe a couple of our villages here have benefited from that, specifically Hyattsville, and then the College Park Neighbors Helping Neighbors actually just received some funding through the General Assembly for the 2027 legislative year. And so, or excuse me, it was awarded in the 2026 legislative year, but it would be awarded as part of FY27. So that would be July 1. And so that money actually flows through our agency and is distributed to the villages. Our Aging in Place grant is open right now. If you want to go to our aging.maryland.gov website, we have a very small, woefully inadequate amount of money that is devoted to villages. It's about $100,000. And of course, we would love to see that grow more. And that's something that I'll talk more about as to how we're leveraging our resources. So I just wanted to really acknowledge the impact that this grassroots movement has. And I had the great fortune of working with DC's Capitol Hill Village, which was the first village that was established here kind of in our DMV area many years ago, and called Gail Cohn, their former executive director, a good friend, colleague, and mentor. So who are we here at the Maryland Department of Aging? We really, as under this administration with Governor Westmore and our our Department of Aging Secretary, Carmel Roque, we have shifted the vision of the department to really uphold our statutory requirements, but also to acknowledge that the Aging Services Network, as it was established back in 1965, is dramatically different from the 1960s to today, and that our institutions, our systems, and our norms really need to evolve with the way in which the way in which our communities operate, the way in which we are living longer than we once did back in, many, many years ago. And so as a result, we really have set a vision that we believe all Marylanders, not just older adults, but all Marylanders have the right to be healthy, financially secure, socially connected, and purposeful. And recognizing that as we are living longer, nearly all of 5-year-olds today, so think about your neighbors, your family, your friends who have perhaps grandchildren, nieces, nephews, etc. If they're about 5 years old, they can expect to live to 100 years of age as a norm. So when I first started with working with older adults in the late 90s, when someone hit 100, you would get like proclamations from the president of the United States. That was a really big deal, right? Now, it's the norm. So pretty amazing. And that also speaks to how we really need to look at and transform our institution systems and norms to be prepared for these wonderful added years of life. So our mission at the department is to prepare for the growing population of older adults, like I just described. And we see our way in doing that as developing innovations, approaches to aging, and that we recognize that we cannot do this alone as simply the Department of Aging, but that it really takes all of us across sectors to be successful. And like I said earlier, we believe that it's critical that there's equitable access to resources. Basically, we want to ensure that all Marylanders have a fair opportunity to living in good health with financial security, and like we said earlier, to be able to afford these longer lives. So our role is a little bit different, being that we are at the state, and I've had the great fortune of working at the local level, so at the county level, and also in DC as sort of a hybrid between county and state. And so the way in which we differ from the county level is that we are really about, what strategic planning do we need to do? What are the partnerships that need to be developed across state government? Also across sectors with our local agencies. We see the role as being leaders around older adult policy and legislation, and advising decision makers, elected officials about the needs, the supports, the opportunities for the older adult population, caregivers, and also families. And then lastly, it's essential we see as affecting long-term change is dependent upon developing robust policies and also legislation. So where do we fit within the Aging Services Network? So our primary federal agency that oversees our work under the Older Americans Act is within the Health and Human Services Community Living Administration, with the Administration on Aging. We at the Maryland Department of Aging is the state unit on aging. So we are designated as that state unit by ACL, the Administration on Community Living. And then under us are the area agencies on aging, also known as AAAs. AAAs are our boots on the ground. They are the local service providers and provide direct services. And so the Prince George's County Department of Aging provides access to services, has what's called Maryland Access Point. So if you are interested in information and assistance, need referral, just really don't know where to turn, as it relates to maybe home and community-based services, caregiver support, even health promotion. And also, lastly, elder justice issues, like, if there's any concerns around the elder abuse, neglect, exploitation, scams, fraud, etc. It is really the Area Agency on Aging, which is the first stop, and they have answers to all of your questions. And what we do is we get both state and federal funds that then we grant to the 19 area agencies on aging that are located across the state. Every one of our 24 jurisdictions have an area agency on aging that serves them. So this is a list, and I saw in the chat someone was asking if the slides would be available. Yes, absolutely, the slides will be available, and I will send them to Carter following this discussion. And so you can see over at the top right-hand corner, Prince George's County, and that is where you can access Maryland Access Point. And then also, because we recognize that we are connected across our communities, this is a list of all of the 19 area agencies, and feel free to share with folks, who may benefit from this information as well. So we were talking about caregivers just very briefly, and I wanted to just share, I always like to, when I'm doing especially presentations to local communities, is to provide tools that you can walk away with. So not just be kind of theoretical about like, okay, this is what we're doing, but also really focusing on some things that you all can use. So this is really exciting. We partnered with Johns Hopkins and developed a memory care family checklist. And what's so cool about this is that you can take it if you're concerned about maybe if you're seeing some cognitive changes or maybe experiencing a little bit more forgetfulness or something like that. Or you can take it because maybe you have concern about someone else and you can take it from that perspective. And what this does is it gives personalized results. It will give you a whole host of resources that are generated through the Maryland Information Network, which is also known as 211. We have a partnership with them as well. And so it's an evidence-based tool, digital tool. It is on our website, and I will give you that information a little bit later. And it really helps to just give you a starting point of helping to identify needs. It creates accessibility to reliable information, and then really helps to connect you to any supports that may be needed as it relates to being a family caregiver and or experiencing, or concerns about memory. Also, we were really fortunate to be awarded through the Administration on Community Living about a $440,000 grant, give or take a little bit, a 2-year grant, where we established the Maryland Caregiver Navigation Network. So we've done lots of program development to really support caregivers across the state. We've been able to survey caregivers to get a much better understanding of, what are the needs and challenges and opportunities that we can work to address through policy and legislation, as well as program development. We have caregiver ambassadors who are located in all of our jurisdictions, all of our area agencies on aging. So and those caregiver ambassadors are really there to be able to be a familiar face, a friend to walk through this journey, a supporter as a caregiver, because we know oftentimes caregivers, are balancing a lot of various responsibilities and can benefit from support. And then lastly, like I said earlier, screening tools. So we're really excited about how we've been able to strengthen supports here across the state, as well as have received national recognition for some of the development that we've been doing through the partnerships, through the innovative practices and evidence-based practices that we are creating here in Maryland. So very exciting time to be a caregiver, and so more information on that. So something that's really, like I touched on earlier, is that we are living longer. Marylanders are living longer, and also just Americans and across the world, people are living longer. So in terms of the 60 plus population projections, you can see back in 2020, it was about 22%, almost 23% of our state population was 60 and older. You can see just in 10 years to 2030, that's grown by 4%. This is a big deal, right? Like we were talking before, back in the 60s, when the Older Americans Act was established under President Johnson, the life expectancies and the numbers of older adults were dramatically different than what we see today. We are closer to 2030 than we were to 2020. Hard to believe. And so, we're only about 3.5 years out from more than a quarter of Maryland's population being 60 and older. And you can see by 2040, that population bumps up just a little bit more to nearly 27%. Just to call out, women are represented in the yellow, men are represented in the red. And typically speaking, women have a little bit of a longer life expectancy than men. And so that's why you see these numbers of women being a little bit more than men in terms of living longer and the actual overall population. So here in Maryland, just to put this all into perspective, our total population is about 6.7 million people across the state, between 50 to 64 years old. According to the US Census from 2020, we had about 1.2 million people. One of the reasons why we look at that 50 and older cohort is because, and I'll get into this more about the Longevity Ready Maryland Multisector Plan, but that's a 10-year forward-looking plan. So in 10 years, all of our 50-year-olds are going to be part of that 60-plus cohort. And so if we need to be planning for today, serving for today, and planning for tomorrow, right? And so that's why we're taking a longer approach to how we become prepared for these longer lives across our state. And that's something that's different here in Maryland than many of the other states who are doing similar work. We really believe that our focus and one of our primary functions is that planning piece so that we can be better prepared in that 10-year time than what we are today. So people 65 and older, total population is about 1.8. If you put this all together, 50 and older is 37% of our total Maryland population. That's a lot of people, right? I mean, and when if we were to mobilize, I'm going to put like my little advocacy hat on. That's a powerful voice, and it's a voice that really needs to be heard as it relates to how we are developing policies and legislation here in Maryland that support caregivers, that bring about awareness to the contributions and value of older adults, and the critical role that we all play in our communities and within our families. So I want just to demonstrate how some of this population growth has changed over the years. So I have about 4 or 5 slides, and I'm hoping you can see this pretty clearly. So this is ages 50 and over in 1990. So we have, can you all see my cursor, like where I'm sorry? Okay, good. Okay, so I want you to be focusing. So here's Prince George's County at 18.9. Oops. Oh, okay. Well, I mean, I don't know how I go back. Okay, here we go. 18.9% was the population of 50 and over, 1990. Okay, so that's 30 years ago, right? So I was a high school senior at Northwestern in 1992. Okay. So everybody think about where you were in 1992. I was graduating from Northwestern at the CAP Center. Okay. So we know how many things have changed since then, right? So less than 20%. You can see across the state that, like in our rural areas, the population of older adults was a little bit higher than in Prince George's County. Okay, now we're going to go to the next one. Year 2000. All right, so our yellow here in Prince George's County is getting a little bit darker, and now we're up to 22%. 2010, we've branched into this light green of 25.1 to 30% of the population age 50 and older is 27.9%. So essentially 28% in Prince George's County about 15, 16 years ago. All right. 2020. So this is us about now, right? 32.8% of our total population here in Prince George's County is over the age of 50. Notably, look across the state. Garrett County over here in far western Maryland is at 46%. Nearly 50% of their total population is over the age of 50. What do you think that means for their workforce? For having like home health aides who are coming into the home? Maybe what does it mean for volunteerism, right? Economic contributions, all very, very relevant. Now let's look at the Eastern Shore over here. Worcester County, 50%, this was in 2020, of their total population. All right, we're going to go one more to 2030. And here you go. You can start seeing more than 35% outside of 4 jurisdictions is over the age of 50. Interestingly, Prince George's is actually one of the younger counties, even though 36% is 50 and older. Because here you can see Eastern Shore, Kent County, 54%, Garrett County, 46%, Worcester, over 50%. The Eastern Shore is certainly growing faster than the rest, and that has a lot to do with migration and things like, kind of in-state migration. And then I might have one for 2040, let's say. Oh, no, I don't. Okay. So let's just go back for just a minute. So this is really having a visual, a picture says more than 1,000 words, right? Like, so you can really see from 1990 to 2030 how the older adult population is shifting and growing across our state. Really critical. Here, this is really fascinating, and this helps to set us up for our discussion going forward regarding longevity, preparedness, and readiness across our state. This is a slide about life expectancy by census tract. So this goes down nearly to the zip code level. And this is something that we are really fascinated by and interested in because we know, based on social determinants of health, which are like education, housing, access to nutritious food, access to good health care, right? That helps to set you up for your later lives. So longevity readiness doesn't start when you're already 65 or 80 years old or something like that. It actually starts at day one. And the way in which Maryland's Department of Aging is looking and talking to our various sister agencies is that we all play a part across the life course to being able to support and develop and have a healthier older adult population here in Maryland. So what this speaks to is, and I talked about this earlier, we want to make sure everyone has a fair opportunity at aging well, right? So with that being said, the kind of rusty red that you can kind of see here, that's a life expectancy of 62 years of age. You see the dark blue, so some here in Montgomery County, here, and then this is about the Route 1 corridor, isn't it? Some of these dark blue, who we're talking to today, who, all of us who are here, dark blue, that age expectancy is all the way up to 96 years of age. So so think about who resides in these different areas of our county, across our state, where perhaps there are more resources, wealthier, healthier populations kind of are, here around the DMV. You can see that. We have Prince George's, we have Montgomery, Howard, Baltimore County, kind of the central Maryland. And this is what we want to address. We want all of this to be dark blue, right? And so what do we need to change from policies, from investments to legislation to get our state to have more of an equal life expectancy in that 96 age range and not have a nearly 30-year difference across our communities? So we use a lot of research to inform our direction and our policy and where we are going. And one of those pieces of really critical research is the National Academy of Medicine's 2022 Global Roadmap for Healthy Longevity. And I think this is really powerful. And it's been a bit of a guiding light as we thought about the policies and legislation that we want to be introducing in Maryland. And what it is, and I'm going to read this quote: "The problem for societies is the barriers that systematically prevent people from reaching their later years with the good health needed to thrive and contribute to family and society." So our position is if we're going to see really lasting, effective change, it's not about adding more programs and kind of trying to retrofit some of our funding and things like that into that model from the 1960s. But really it's about what are the new and instrumental systems change that is needed at that systems level that will reduce barriers and help for people to be able to more successfully age. So that's what we focus on. We look at it from this big, broad perspective of how is the system impacting individuals and families and caregivers, and what do we need to do differently that will result in better outcomes. And one of our driving forces is we believe older people are an increasing natural resource. Look at how many of us there are, right? More than 37% of our total state population. We need to be harnessing, and leveraging this incredible asset that each of us are across our community and state. So here it is, the longevity revolution, 1940 versus today. So the 1940s, older adults kind of helped to establish the Older Americans Act and what we need to do. And really, as people were aging in the 60s, they were really, people were aging into poverty in terrible ways. And that was one of the reasons for the Older Americans Act being established. So just from a comparison perspective, US life expectancy back in 1940 was about 63 years of age. Interestingly, as I was sharing in that previous slide, that's not very different for some of the zip codes here in Maryland. But in other zip codes, it's about 78 years of age today. So big dramatic difference, right, of added years. The population over 65 here in Maryland back in 1940 was about 5% of the total population. And I can speak a little personally to this, not that I was back in 1940, but my parents were born in the 40s. And so by the time they had us in the 70s, my siblings and I, 3 of my grandparents were already deceased. I only knew one of my grandparents. Well, I myself have 3 kids. They've known all, and my kids are all high schoolers. They know all of their grandparents. So big difference, right? So that's just kind of a way to really picture and thinking about it from your perspective. Perhaps when you were young, were all of your grandparents a part of your life into high school or not? I think that there's always exceptions. That back when I was a child, I actually had a great grandfather who was 100. That was amazing. But at the same time, that was not the norm. And then also just in terms of looking at Social Security status, which was enacted in 1935, the first monthly benefits began in 1940, really, again, addressing kind of that impoverished, how do we support people who are older? And if that started back in, when you were about 60 years of age in 1935, you were only, the life expectancy was about 3 years of which you would be benefiting from Social Security. Our Social Security really has not changed dramatically in terms of the way in which those benefits are set up and collected and things of that nature. But now 90% of retirees rely on Social Security, and for a much more extended period of time. It just helps. I think like talking about this longevity revolution in these ways helps to demonstrate what a different time we are living in than we once previously were as it relates to life expectancy. So that brings us to, so what are we doing about this, right? So we established the Longevity Ready Maryland, also known as LRM, which is our 10-year multi-sector plan for aging. And what this is really about is to bring to light all of the incredible value and opportunities that older adults, caregivers, and families bring to our great state, as well as recognizing there's also challenges. So there's challenges we need to address, and there's opportunities that we can maximize. So what is a multi-sector plan for aging? It's a cross-sector, state-led strategic planning roadmap. We did extensive stakeholder engagement across all the state. We had more than 2,000 people weigh into this. We led town halls. We had work groups. And the other piece that I think is really critical is this is not a standalone, well, it is a standalone plan, but it was informed through multiple other plans that are across the state, such as like the State Health Improvement Plan, such as the Alzheimer's strategic plan, things of that nature, so that we weren't doing this multi-sector planning process in a vacuum, but we wanted to really lift up other recommendations and strategies and include them in this plan to say, hey, it takes all of us. And this is not just the Department of Aging who needs to ensure that we are working together and we're prepared for longer lives and serving people who are experiencing longer lives, but that we need an all of government approach. And that is what this multi-sector plan is really about. And of course, the core tenets are transparency, nothing about us without us. And that speaks to kind of the stakeholder engagement and our actions. Inclusion. We want this to be a robust plan that is based in equity and social justice, and ensuring that all community members and ages are included and reflected in this plan. And then also person-centered. And what that means is that we put the people in the middle, and then everything else branches out from that. So we have 4 epic goals, as Marianne said during our introduction: building a longevity ecosystem, promoting economic opportunity, preparing Marylanders to afford longevity, and optimizing health, wellness, and mobility. And so we have various priority areas that speak to each of these goals. And then we also identify the other state agencies that are really critical to realizing these goals, such as under promoting economic opportunity, the Department of Labor, the Department of Commerce. We are working with these partners to say, hey, how can we be ensuring that there's employment for all, that there's fair employment for all. And then, of course, that feeds into affording longevity, affordable housing, financial stability. What does it take from a state planning perspective to ensure that there's access to services and benefits, that there's fair housing, that there's a way to earn a fair wage. And then, of course, in terms of optimizing health, wellness, and mobility, it's really about access to equitable systems of care and how we are coordinating across those systems of care to really ensure that everyone has the chance of aging well and aging healthy. So just to put this as, put this in a timeline of how we began this process of establishing a multi-sector plan on aging for the state of Maryland. So here is, I was fortunate enough to be there for the signing of the Longevity Ready Maryland executive order issued by Governor Moore. Here I am, and here is Secretary Roque, who is really our visionary and just tremendous leader of our department. And if I may say, we just kind of have this magical moment with the team at the Maryland Department of Aging, and we are a group of change makers, and we are there to do the best that we can for all older Marylanders across our state. So I think you can probably hear it from me that it's just a joyous moment in my professional career to be able to be a part of this really groundbreaking and just critical work that we're doing. So anyway, so here's the executive order signed in 2024. Here is the intensive stakeholder engagement. We did that from 2023 to 2025. So, and you're kind of like, wait a minute, you did the executive order in 24. Well, we started that stakeholder engagement the moment we walked in the door. As when Secretary Roque was appointed as Secretary of the Department of Aging, we knew we wanted to advance a multi-sector plan on aging. And we knew that we needed to hear from the people of Maryland to do so. So that stakeholder engagement helped to inform the executive order, which then led us to our actual multi-sector plan on aging. And here, which is so wonderful to recognize this, is we have the Secretary for the Department of Planning here, Secretary for the Department of Human Services. And what that demonstrates is the critical multi-sector coordination and collaboration that is essential to this process. The other piece that's really first in the nation and something that we're incredibly proud of is that the state units on aging have to do a state plan on aging every 4 years. Prior to Longevity Ready Maryland, the way in which our state, as well as other states who have multi-sector plans would do it is they would do their state plan on aging, and then they would then do this additive multi-sector plan on aging. But never to be combined. And what we said is that just really makes no sense. Our state plan on aging should be informing our multi-sector plan on aging and vice versa. So I'm proud to say we are the first in the nation to combine our state plan on aging with our multi-sector plan on aging. We're about the 11th state to have a multi-sector plan on aging, and that the Administration on Community Living approved Longevity Ready Maryland as our state plan. So having that federal recognition is really what is really fun is we're being looked at as a model for across the nation. Minnesota just reached out and said, hey, how did you do that thing of combining your multi-sector plan and your state plan on aging? We want to learn more. And we are out and about talking about that and really, ideally influencing this next wave of how we are developing policy, not just here in Maryland, but across the nation. And then lastly, and I'm going to talk a little bit more about this is the Longevity Ready Maryland Act, which then codifies for the long term in law what we say we are going to do as it relates to Longevity Ready Maryland. So when those of us who are around the table now are no longer around the table for whatever reasons, there is a law that says those 4 EPIC goals, we as a state need to be working together to achieve those. And the Maryland Department on Aging needs to be reporting to our lawmakers and our governor about the progress on those goals. So some of the foundational work that really we are proud to be able to say that we've accomplished is over these last 3 years or so is we've redesigned some really critical programs. We get about half of our budget is state funded, half of our budget is federally funded. And so as it relates to our state budget, we get about $45 million that is operational. And then also and the great majority, only 10% is really operational. All the rest goes out to local communities, either through the area agencies on aging or through those grants, like the Aging in Place grant that I spoke about before. And so what we have done is where we have the authority to do so, we've really looked critically at our programs and said, are these programs still serving with the intent that they were designed for? And how do they need to evolve to be relevant to today? So that's work that we've been leading. We launched the lrm.maryland.gov website, which includes a data dashboard. So if you are really interested, and I've seen some of the chat questions coming up about percentages and, hey, what's this mean? What's it look like for Prince George's County? You can go to our data dashboard and you can be pulling that up and seeing how Prince George's County compares to other counties and really looking at the overall data for our state as it relates to longevity readiness. And then, like I said, we've passed legislation. So we've actually had 2 really successful legislative years where we've been able to advance critical laws for the benefit of older Marylanders and caregivers. Lastly, we are leveraging that little bit of money that we have of Aging in Place grants, and we've aligned with one of the governor's signature programs, which is the Enough Initiative, where we're driving resources to local communities to advance longevity readiness and overall equity. So the Longevity Ready Maryland Act, we passed that this year. And like I said, this codifies what we are doing as it relates to longevity planning. It helps to establish Longevity Ready Maryland in our broader work of the Maryland Department of Aging. Also, critically speaking, it expanded the role of the Maryland Commission on Aging. And the Maryland Commission on Aging is made up of representatives from across the state. The members are appointed by the governor. We now are including Area Agency on Aging representatives who can help advise on those local interventions, as well as we hope that our AAAs will be catalyzing change in local communities in alignment with Longevity Ready Maryland, as well as it's made up of academics, philanthropists, caregivers, and other representatives who are interested in the work of the Department of Aging and planning for this broader work across the state. And then lastly, what the Longevity Ready Maryland Act did is requires comprehensive updates, like I shared, to the Longevity Ready Maryland every 4 years, accompanied by annual progress reports. So again, what this does is it builds in sustainability for this really critical planning process. And again, that is also a first in the nation law that we were able to pass here in Maryland. I hope you guys are as proud of Maryland as I am. Let me just tell you, I mean, we are out there and we are just leading the way. So it's so fun to be a part of it, and just really amazing to see what a dedicated group of outstanding leaders and members of our team can accomplish with collaboration and coordination. So I have goosebumps right now just even thinking about all of this. So what else did we do in the 2026 legislative session? And legislation is so critically important, and you have legislators throughout your community, whether it be your county council, whether it be Maryland state representatives. Speaker Pena Melnick is a true partner of the Maryland Department of Aging and is so committed to older people, in her district and across the state, and is regularly calling us up or talking with our legislative director about access and assistance for constituents. And it is just such a pleasure to be able to work with her, as well as others, other elected officials across all levels of government. And so again, your voice is so powerful and our elected officials want to hear from you. So, and we do as well. So be sure to, because your voice influences what the outcomes of the legislative session are. And so what's really notable here, Maryland, from the Baltimore Sun, February of 2026, Maryland lawmakers are considering an unprecedented number of bills addressing the quality and nature of elder care as the state grapples with a growing senior population. It's a little, we don't think we necessarily are grappling, do we? But it is really about, hey, this is different than what it's been before, and what do we need to be doing? So the House of Delegates and State Senate considered over more than 20 bills that aimed to improve care for older adults, including Longevity Ready Maryland Act. Department of Housing and Community Development had presented the Starter and Silver Homes Act of 2026, really talking about affordable housing and how we can build a better continuum of housing options and housing stock for new families, individuals, all the way up to aging in community. We established the Aging Resilience Fund, which is incredible. What that is a special non-lapsing fund for the Maryland Department of Aging, where we are able to accept philanthropic and or other private sources of funding, which then we can utilize to address the systems change that we've been talking about. And then lastly, and you all will be likely interested in this, the Aging in Place program, so the grant that I know the Hyattsville Village benefited from, that was the North grant, excuse me. The Aging in Place program grant, Delegate Wallach out of Montgomery County introduced multi-generational third places. It added to this overall legislation, which allows for villages to apply for these funds to be able to have a meeting place for like intergenerational activities, like to be able to pay for rent or a lease or something like that, recognizing that that's a pretty expensive, it's a pretty large expense sometimes for villages, and that it's nice to have a place to gather. So our overall legislative session, in terms of just simply our Department of Aging, we have an incredible legislative director, Andrea Nunez, who leads all of our legislative work. We were successful getting 3 of 3 priority bills passed, so 100% rate on that one, which we celebrated. We analyzed over 100 bills and monitored very closely that were relevant to older adults, families, and caregivers. Across our team, we delivered 55 pieces of testimony. So that was either in written testimony or even going and testifying in person. 84% of those bills that we were analyzing and monitoring closely reached the desired outcome. So that also is pretty impressive. And then 25 of the bills that we supported passed with our testimony. So you can see we are actively engaged in the legislative session. It's basically an all hands on deck because we are a small but mighty team. And we want to make sure that older adults are represented, throughout our lawmaking process each year. So here's a great picture. I love this picture. So this is with Governor Moore, and you can see Speaker Pena Melnick. And then this is just a group of phenomenal representatives across state government and advocates. We have AARP advocates and volunteers. We have, this is our AAA director for Montgomery County, AAA director for Howard County, Baltimore County, also Montgomery County. Here's Secretary Ropes. This is Anne Blackfield. She is the Deputy Director for the Department of Disabilities, Secretary of Department of Disabilities. Here is David Conway. He is the state AARP lead. Over here, we have the Department of Veterans and Military Families. We have an intern from University of Maryland, right? What this talks about and demonstrates is vested interest, all right here, about how we can better and more adequately serve and plan for older adults, families, and caregivers. So just really, really incredible. And you see, look at the diversity here, diversity of ages, diversity of people, diversity of backgrounds. And that is what is critical to, it's one of the things that's unique to Maryland, and it's one of the things that's so critical to longevity preparedness. Takes all of us. So here's LRM in action. I've talked about a lot of this, we've had some great strides with working with our partners at the Department of Housing and Community Development, where we have gotten some various awards to develop the capable model, which is really about aging in place and providing home modifications, doing environmental assessments and things of that nature. We have had a really incredible work around our Maryland Access Point and modernizing the systems that work on your behalf when you're calling for information and assistance. You can call 211, which is called MapLink, and get assistance from anywhere in the state, as well as, like I said earlier, your local area agencies on aging. And then caregiving. We know that caregivers are the backbone to aging in community, both formal and informal caregivers. And so we are really looking at how do we stabilize the care workforce? How do we provide support for family caregivers across agencies? Again, I can't say it enough. This is not just the Department of Aging. This is across all of government that we need to be coming together and looking at how and what we are building as supports and interventions. Okay, so Longevity Ready Maryland, lrm.maryland.gov. This is where you can go to see the plan. You can see our annual reports. You can see the data dashboard. I recommend going. We just redesigned the website. There's always more information being added. And there's also a constant contact list. If you're interested, you can sign up for our various newsletters as well and kind of stay in the know. Looking ahead, our priorities for 2026 and then basically fiscal year 27, which begins on July 1 and will run through June 30th of 2027. We continue our priorities around caregiver support, no wrong door access to services, which is our map and information and assistance, really looking at how we can continue to strengthen that system. I didn't talk a lot about this, but healthy nutrition. Also at your area agency on aging, we have congregate meals, delivered in senior centers and things of that nature. But there's also, that's the place where you can sign up for home delivered meals for those individuals who may need that. We succeeded in codifying LRM into law. So now we are implementing that law. It takes effect October 1st. We're, stakeholder engagement. It's, again, nothing about us without us. So we really value hearing voices, listening and learning. And all of that listening, learning, and those voices go back into developing our strategies, what the priorities need to be. And then we're soon going to be, actually just next week, talking about, hey, what are the laws and policies that we need to be thinking about for our next legislative session. So that stakeholder engagement and meetings like today help to inform our path forward. And then philanthropic partnerships. Something that's really, really important to the work of multisector planning is private philanthropic partnerships. And we continue to work with local and national philanthropies to see what kind of partnerships and investments we can be making together. So all of that to say, multi-sector investment is critical across the full lifespan. And this slide here just highlights all of the various sectors that it takes for us to really maximize the opportunities and address the challenges of living longer. So this highlights state government, our local governments, and the area agencies on aging, healthcare providers, how can we better close that gap between sort of what's called social care and healthcare? Because we know that addressing the social determinants of health, like we talked about earlier, actually impacts health in a major way, and certainly then impacts how people are able to age going forward. Community-based organizations, again, just the heartbeat of local communities. Philanthropy, advocacy groups. I love a good advocacy group. They help to keep us accountable, right? Business and employers, we all play a role. And then lastly, federal government. You know, there's oversight, there's compliance, and then also that it's a funding source. So we really work closely with our federal partners to leverage and maximize the support that we receive there. So what can you all do? Please get involved, okay? So advocate for strategic investments in aging services. Like I said, building those public and private partnerships are really critical. Advocacy and policy support, I can't say it enough. I'll tell you, in the legislative session, there's nothing more powerful than having people testify on bills and during hearings that impact their lives. Technology and innovation and data collection. This is something, what we talked about was, you know, when we came in the door, we were information rich and data poor. So what we're trying to do is really take that information and use and apply that to data so that we can make data informed decisions and not just sort of anecdotally say, oh, I think this is a good idea, you know? So we really are using data to inform that direction forward. And then lastly, community engagement inclusion. Keep doing what you all are doing. What a powerful movement you are a part of as part of this village network and what you're doing within your local communities. I can't stress that enough. So thank you. Here is another QR code. Also, if you like sort of the old-fashioned way of typing in you know, web addresses, here we are, and we have a presence on Facebook, LinkedIn, Twitter, and Instagram. So with that, I would love to, you know, answer any questions, have a discussion, learn from you, and get any reactions. So thank you.
Thank you, Jenna. That was fabulous. As somebody approaching the 100-year span versus the 62-year span, it's just so exciting to see the state involvement. I've been fortunate to work, well, it's in City of College Park, where the mayor and council established at least 10 years ago a senior advisory committee. We weren't mentioned in strategic plans, Vision 2030. Nobody thought about this population that's almost a fourth of the population, the community. So it's just really very exciting. And to see, wasn't this the Agency on Aging upgraded at the state level to a cabinet position?
So we are one of the few in the nation that has been a cabinet level. We've been a cabinet level since I might get this wrong, early 70s or early 80s, which is highly unusual. A lot of times, in terms of departments of aging, they sometimes are an office on aging and they're combined with other larger agencies, sometimes like the Department of Health or the Department of Social Services or Human Services. And what ends up happening is, and very similar to what you're talking about, that the older adult advocacy and voice is combined with a lot of other voices. So getting prioritization and getting the, you know, sort of those things heard is a real challenge because there's such representation of lots of other, you know, critical areas and populations. So the fact that our secretary has a seat at the cabinet table is really beneficial for all of us.
We certainly thank you. And I love that. Carter, do we want to go with raised hands or chat, or how do you want to do that?
And am I still sharing my screen or no?
No.
No. Okay. I thought I turned it off, but I wasn't sure.
Why don't we go ahead and let Mady with the raised hand, and we can sort of alternate between and get through the chat ones
Okay.
and in person.
Okay.
I have a strange question
Okay.
because I'm usually strange. This is wonderful, really great. And I want to know if I'm an avid knitter, and I want to know if you would like a hand knit scarf that I've made.
I would love one.
And
Yes,
and
please.
you'll have to give me your phone number so we can.
That
Okay.
sounds great. And Maddie, where do you live? Are
Mady.
you Mady? I'm sorry.
Yeah,
Mady, where do
I
you
get
live?
that all the time. Rhymes
Yeah.
with lady. We live in College Park Woods.
Oh, okay. So my parents are right in College Park. So we'll connect after this and
That would be wonderful.
we will connect.
Okay.
Well, and I'll tell
Even
you
my
a funny
husband's smiling. He usually says, "Mady, don't do that."
Oh, well, thanks. I will tell you, knitting wise. So, as a social worker, you toil away and you don't really always see tangible outcomes, right? Just because it's complex, right? And so before I had kids, I started knitting because there was a really clear start, middle, and end. And then I would have this tangible, yes, exactly. I would have a tangible product. And I felt like at least I was accomplishing something, right? So,
And I give them away. And I'd
That's so-
love to give you one. And in fact, I love to knit in person with other knitters and crocheters and anybody else who would come to
absolutely.
my house.
Yeah. Oh, I love that. In fact, in Howard County, when I was there was a whole group of people who knit, and they would knit for veterans and send hats over, across seas.
VBA donations.
Yes, exactly.
That's what I've been doing a lot. But
It's
my
really
husband and I are going to be away at our beach condo. But when we come back, I want to get together with you.
That sounds wonderful. I would welcome it. Thank you.
Carter, I can't get the chat for some reason, so do you
Okay.
mind?
Yeah, no problem. So there are two questions sort of piggyback off each other, or crossover. The one is, how are the longevity ready Maryland priorities affecting services and support in Prince George's County? And then similarly, can we expect any changes in our AAA because of longevity Maryland here?
Okay, so both really great questions. So I don't know if you all know, but you have a new AAA director. Lisa Bryant is the AAA director for Prince George's County. She just started in January. And in terms of the services and longevity preparedness, we have the General Assembly approved legislation a couple of years ago for Alzheimer's and related dementias. And those dollars are granted to the AAAs. And so, this is not a notable, it's a very notable statistic, but an unfortunate one. And that is that Prince George's County has one of the highest prevalences of Alzheimer's and other related dementias out of the entire nation. Within the top 5 across the nation, with Baltimore City also being in that top 5. And so one of the things that we are working on with Prince George's County and just also across all of our AAAs is really how do we better support people who are living with Alzheimer's or other dementias? How are we supporting caregivers? And what does that look like, to include some respite grant dollars and then also some of those systemic changes like the Johns Hopkins University checklists and things like that to give people a jumping off point to begin getting some supports. So Prince George's County, of course, benefits from all of these systemic changes that we are driving toward and developing. And the other piece that we did with Longevity Ready Maryland, and with it being part of our state plan, the AAAs just recently had to write their 4-year area plan. And we included the 4 EPIC goals as part of the requirement that our area agencies on aging were to address as part of their as part of their 4-year area plan. And that should be effective in October, because it's on the federal timeline. But you could reach out to Prince George's County to see exactly how they are planning to align with Longevity Ready Maryland. And I would actually say, not that you're asking for advice on next speakers, but if I may say so, I would recommend inviting the Area Agency on Aging and hearing from them directly. It's a big county and there's a lot of great things that are happening, but drawing that relationship a little bit more close so that you all hear firsthand is probably very worthwhile.
Thank you. Just alternating again, Lisa, why don't you go ahead and go?
Okay, I think I'm speaking, right? You
Yes.
can hear me?
I can.
Thank you very much for that. Appreciate your presentation, and very much appreciate the Aging in Place grants that the state has offered. Really, only 20% is dedicated to villages. So I'm hoping at some point that may expand. I would also just like to put a plug in for the fact that we have only 6 villages here in the county, and it really is important that we try to reach out beyond Route 1. I mean, we do good work here on Route 1, but there are lots of areas that are not served. We end up, all of us who run a village here, do take phone calls from all over the county. But we do need to be able to expand beyond this. Certainly Montgomery and Howard have done so, and the district has done so.
Yes, yeah. And there's a whole network, I'm sure you're well aware of, the WAVE network. And then also, I mean, there has been previous legislation that various elected officials have introduced around like hub and spoke models, where one village kind of serves as the hub and helps to train other villages to be able to be stood up or, kind of expanded across certain areas. And that might be a model to look at and talk to, both your local and state elected officials about, and kind of what that could look like. And investments can come from a variety of places. So, and that's really what we talk about in terms of like the public and private partnerships. What could that look like? And how do we, strengthen this movement and strengthen the presence? Another really great resource and very active community is the AARP chapter for Prince George's County. And I would, encourage you to connect with them as well. They're more sort of in the southern part of the county. And they are very close with Delegate Kim Taylor. I believe that some of the president or something like that is from her jurisdiction. So that could be.
I do think both, I think College Park and Hyattsville are age-friendly communities, and the University of Maryland is also expanding and attempting, I think, going to apply to do that.
Yes.
So, I think, well, it would be helpful for us to be able to figure out how to expand beyond it. And in fact, the Aging in Place grant that I think that we got 2 years ago really was to hold meetings around the area to try to encourage other places to become villages, to organize to become villages. And one of them has in fact done that. That's the Gateway. But we had hoped that Riverdale and Riverdale Park and other areas, I think Capitol District Heights and Bowie were also looking at it. So
that's great. And something I didn't mention in my presentation, but from an evaluation perspective, we are working with the University of Maryland's Department of Public Health, and they have what's called the Sunshine Center. And there's a whole acronym for Sunshine that I'm not going to be able to pull from my memory. But know that there is interest right there in College Park in the work that we're doing in Longevity Ready Maryland. There's also, we have a partnership with UMBC that's doing asset-based community development, ABCD. And we've been partnering out in Western Maryland as well with the universities there. So, you know, I can send that information to you. I mean, I would definitely recommend, you know, talking with the university about just, you know, what is happening right here in their backyard and figuring out where there might be some opportunities to better connect.
I think there's also something out of the Provost office at the University of Maryland, which is reaching out to the local organizations, because we sat in on a phone call. I think a number of us sat in on a phone call about a week ago, 2 weeks ago.
Oh, that's great. Oh, good. Yeah. I mean, it really, I think it's just building those partnerships. And I would also say sometimes they take longer than you want them to, you know, but I always think about like planting seeds. You never know when something's going to kind of grow more and more expansively than you think. And it seems like the timing is good for right now. You know, we're in a bit of a moment, I think. So
thank you.
So there was a question about how these programs and priorities are they looking at and addressing broader issues that affect quality of life. Specifically, the person asked about poor quality of our air, elimination of green spaces for data centers, etc.
Yes. So you're talking essentially about environmental justice, right? And that's the way that we've looked at it. Our Department of Environment at the state developed a climate plan, and every department across state government was responsible for creating a climate plan, and we did that. So those are things that we work closely in terms of our partners planning, Department of Environment, also just, you know, from an age-friendly perspective, thinking about you know, the community environment and walkability and all of those things, and also recognizing that environmental factors impact how people can age. And so, yes, that is part of Longevity Ready Maryland. It's also an area that I would say we do need to expand upon, and will as we get deeper and further into this work. But it is something that we acknowledge and recognize.
Fantastic. Do you know if there are any pending bills working to reduce state taxes on houses owned by seniors?
Oh, great question. I don't know of any right in this moment. I do know that as it relates to affordable housing, is that that we know that housing and being able to and property taxes and being able to afford living in the community is tough, and the cost of living is substantial here in Maryland, and for a variety of reasons, right? And part of like that starter and senior homes bill that it didn't pass, and sometimes you have to introduce the same concept many times and over many years before you get the traction that's needed. But really what that was talking about is we need good, viable housing that also is designed for aging in place, aging in community. And what that can look like is universal design, so that, you know, any ability or any mobility issues can reside safely within those places. And and Prince George's County actually was a leader in this area around universal design. I think that there was actually a local law that was recently passed, or tried to be passed by the county council on this, about kind of new housing and things of that nature. There are a variety of different tax credits. There's like a livable homes tax credit, like if you're making home modifications to your home and things of that nature, that are designed to help people, one, create a safer environment, to assist with affordability. But in terms of actual kind of reductions in property taxes, I don't know of anything right in this moment. Although other places, I know when I was in Howard County, that was something that was done, and the age threshold for how long you lived in your home was actually reduced, I think, from like 35 years down to 30 years and things. And it was kind of a time limited tax program. I would say that the Area Agency on Aging map is a good first stop for talking about some of that tax assistance.
Yeah. And then one question you had mentioned about trying to have different governmental agencies and resources working together with villages and other groups and community support aging spaces. Joan Novell from Tarmac Triangle Village was saying it would be a benefit to our central elementary school could be used as a free meeting area. Who do they talk to? So I figured that it's probably going to start with the principal or Montgomery County Public Schools, but the Board of Education as well, maybe. But I know there's like direct outreach going on from the state.
Yeah. So we're not doing that, but I think that that's a great idea, because actually the Department of Education at the state level is a partner that we want to be cultivating more. We also recognize from an intergenerational perspective, there's a lot of opportunity to be bringing the generations together. And what could that look like? I would say the first best step is to talk with the principal at that local elementary school. Many community organizations, I know here in my community, meet at the schools and different clubs and things like that. And there's usually a scheduling process that you can do that. Also, rec centers, senior centers, things of that nature are also really good resources. And libraries. We love the libraries.
Okay. Does anybody else have any questions that they'd like to bring up? We've gotten through everything that was in the chat.
Can I say one thing? This is Diane. Hi, Jenna, and thank you so much for that presentation. It was very, very educational. I didn't realize we had so many opportunities that we could take advantage of, and I'm definitely in that situation now. If you could, when you have a moment, reach out to me offline.
I will. Yep.
I would really appreciate it.
Okay. So Diane and I, well, we go way, way back, right, Diane?
Yeah,
way back. I actually babysat for Diane's kids back in the day. And then we were neighbors for about 10 years. And Fred Hicks, Diane's husband, sold us our first house in College Park. So, yeah. And so we could see into each other's backyards.
Yeah, exactly. And we did.
We did, yes. So, so it's good to hear from you, Diane. I'm happy to follow up. I definitely will.
You as well, and I'm very proud of your success.
Oh, thank you. Thank you.
Tell Mom and Dad we said hi.
I will. I'm going to see them later at a graduation party. It's that season.
Very good. Okay. All right. Thank you so much, Jenna.
Thank you. Take care.
We're right on time. I'm very impressed at us. It's 3:25. Jenna, that was more than we could have asked for. It was just really terrific. And we do look forward to, we're loudmouth people down here, so you will have conversations from us, and please don't hesitate to call on us if you think there are things that we can do. We often, for instance, help the university students on capstone projects with surveys or interviewing the old people, would they use this app? Do they like? So I think the stakeholder merging is just really the answer. So thank you all for attending. And just a reminder that we will be doing this again in June 27th. Eric Keyes, who is the director of the art program at the University of Maryland Global Campus, will do a session on the art. And as I understand it, UMGC has the largest collection of Maryland artists in the state. I We'll double check that, but they are currently, or towards the end of June, we'll be doing an exhibit by Joseph Shepard. And for those of you not familiar with him, he is pushing the 100 mark. He's amazing, a local Baltimore artist, and so he does lots of Baltimore art. He also lives in Italy half the year, so you get a little vineyard and stuff. But anyway, that'll be our presentation in June.
Will it be on Zoom?
Yes.
So we can get it when we're away.
Yeah. And then we have recorded this, and Carter will get the recording out to you, which maybe will solve your problems because you'll have the slides on the recording. And so he'll get that out to you maybe the middle of next week. So thank you all for attending.